Good afternoon, everyone. My name is Sarah Jennings, and I will be the principal investigator for this proposed study, a reduction in PTSD symptoms in veterans using mindfulness-based stress reduction therapy. I am currently a graduate student at Point Loma Nazarene University in San Diego, California. I'm a student in the MS Kinesiology program with a focus in integrative wellness. The proposed performance site for this study will be held at the Fort Stewart Army Wellness Center, located on Fort Stewart, Georgia, a United States Army installation. Diving into the background and significance of this study, there's some staggering statistics on the right side of your screen, as well as a great diagram of the effects on the brain there to the bottom left of your screen. We can see by these statistics that PTSD is still very prevalent in our military veterans, with 23% of Iraq and Afghanistan veterans experiencing symptoms of PTSD. 12 to 15% of our Gulf War veterans are experiencing symptoms of PTSD, and the staggering number of 30% of Vietnam veterans experience symptoms of PTSD. And more than a third of those veterans that are diagnosed with PTSD fail to ever recover. And it's a safe assumption to say that these numbers are probably quite a bit higher, because despite the best efforts of military mental health physicians and departments, there's still a real stigma around veterans seeking help for symptoms of PTSD. So it's safe to assume that these numbers are greater currently. Used as an adjunctive form of treatment, mindfulness-based stress reduction therapy through this study will show reduction of symptoms in PTSD. And this study will assess the scores of the PTSD checklist military version and will assess before and after MBSR therapies are used. The research hypothesis for this study states that the use of MBSR as an adjunctive therapy will show a clinically significant improvement in symptoms of PTSD in veterans. In contrast, our null hypothesis states the use of MBSR as an adjunctive form of therapy will have no clinically significant effect on symptoms of PTSD in veterans. Let me go back. Diving into the literature a little bit here, based on the present data and studies previously done, MBSR does prove effective as a form of PTSD therapy. Some of the conventional therapies out there right now and the first-line treatments that are being used are treatments such as CBT, or cognitive behavioral therapy, and some pharmacological treatments like selective serotonin reuptake inhibitors and noradrenaline reuptake inhibitors. And while they are considered first-line treatments for symptoms of PTSD, they have not been shown or not been proven to be very effective with improving and managing those symptoms of PTSD. Some of the non-pharmacological treatments that are currently available are treatments like psychoeducation, eye movement desensitization, and reprocessing. They have shown some effectiveness on managing symptoms of PTSD and improving them. The problem is that they require a re-experiencing of trauma. And so most veterans avidly avoid these types of treatments because they do not want to have to re-experience the trauma from their time of service, especially because a lot of the problem for them with the symptoms of PTSD is that constant re-experiencing of the traumatic events, that replay over and over in their brains. So some studies conducted before us showed promise for MBSR when measured by the PTSD checklist as an effective adjunctive therapy or an adjunctive form of treatment for symptoms of PTSD. The PCL or PTSD checklist is highly regarded. It's a self-reporting tool, and it's used as a provisional tool for PTSD diagnosis. The PCL has evolved over the years, and now there is a PCLM version, the PTSD checklist military version, which is a survey of 20 questions that's directly service related, directly related to their service experiences, military service experiences. And the PTSD checklist does have a high internal consistency and a high retest reliability. When considering what is a clinically significant change, according to the National Center for PTSD, a 5 to 10 point change on the PCLM is considered reliable, while a 10 to 20 point change is considered clinically significant. So for the purpose of this study, we're going to be looking for a 5-point change minimum to be considered as a change. And it's safe to assume that those that point change will probably be seeing higher numbers than that 5-point change. So this study will be conducted over a period of 12 months with 100 qualified participants. Once those 100 qualified participants have been chosen, they will be randomly allocated to 2 different groups with the clinicians and instructors blinded to that allocating process. The 2 groups will be made up of an experimental group and a control group. The experimental group will be experiencing training in MBSR therapy and use of MBSR throughout the study, while the control group will not receive MBSR training and will continue with their current treatment plan as prescribed by the direction of their physician. The MBSR training will be conducted by licensed clinician or instructor trained specifically in MBSR therapy. And the training for participants will be conducted over 8 weekly sessions for 2.5 hours each. And in addition, a 1-day full retreat format of training. As stated previously, the primary assessment tool that we'll be using will be the PTSD checklist military version, or the PCLM. Both experimental and control groups will respond to the PCLM 6 different times over the duration of the 12-month study at baseline, 2, 4, 6, 8, and 12 months. In conclusion, our expected outcome is positive. Our expected outcome will show a clinically significant reduction in symptoms of PTSD in veterans using MBSR therapy, while the control group will show no significant, clinically significant change based on solely following their current treatment plan of care as directed by their physician. So I hope you have enjoyed this presentation today. I really look forward to your feedback on how this proposed study can be a great success. Thank you.